Okay. So did everybody have a nice weekend? Okay. Cool. Let's see. I started grading professional development plans yesterday. They were beyond awesome. It is my favorite assignment to grade during the whole term. My favorite assignment to grade. I love the professional development plans. We used to have them in like week 6 or 7. And I made the suggestion about a year ago that we really need to get these in week 1 so that we know about the students and know what their short-term, long-term goals are. So I have to tell you that I'll finish grading the rest of them today, but they were absolutely fantastic. So a lot of really good. The future of nursing is going to be in good hands with this small group. It was really quite impressive. Okay, we've got Sarah coming in. Hey, Sarah. So we are missing Mamie, Celine, and Amone. Oh, and Jean. Okay, well, we're going to get going. But anyway, so welcome to week 2. This week we're going to cover chapter 18, 19, 20, 18, 19, 20, and 31. Okay. And so just a couple of things to review. On Saturday morning, I sent out the lecture 1 recording. Everybody get that? Okay, that is up to you to listen to. I can just track views. I don't know who's viewing it and who's not. So that is for your benefit, right? So between that recording and today's lecture, everything should be covered in preparation for exam 1. Okay, since exam 1 covers weeks 1 and 2. Okay, so you all have your study guide. So if you haven't had a chance yet, I would go back to the week 1 notes that you took with regards to the content lecture I sent on Saturday, and just start highlighting the study guide of what's been covered. And then if you've already done that, great. The empty part of your study guide that hasn't been highlighted will all be covered today. Okay. So everybody, does anybody have any quick questions before we get started? I have several things to review with you, but does anybody have any questions about processes and anything? You got my email on your NCLEX. We're working on trying to get the NCLEX link right into the module, but in the meantime, there's an NCLEX link in your student resources, or you can go through another class, Med-Surg Peds. Do you have NCLEX and Peds? Yes, no?
We haven't gotten that.
Yes.
We haven't gotten that far yet. I'm not sure.
Okay, but you can access NCLEX through maybe your Med-Surg class for now. Okay, so you have, pardon me?
They should have an NCLEX on Peds.
Okay, so you should be able to, so you're going to have to access your NCLEX either through your student resources or one of your other classes up to now. And then please don't just submit page 1 of your NCLEX, you got to submit the whole PDF. Okay, so it's like between 11 and 15 pages, as I need to go through and make sure you selected the right subcategories. All right, so I think I've sent 1 or 2 messages out to resubmit NCLEX with all pages. I need all pages of NCLEX. Okay. Just want to review with at least the people that are here. Pardon me. Is anybody from any other campus other than Nashville, Cutler Bay, or Cuyahoga Falls? Do you all fall into one of those? Super. Okay, great. Okay. Does anybody, let's start. My first question is, for those of you that have listened to the Saturday morning week 1 content lecture, do we have any questions or anything we need to review? Okay. I want to remind you this past week that I did send out announcements. Well, I might have sent this past week. Did you all see the announcement that had 3 Kahoots attached to it? One was for week 1. One was the additional week 1 chapter of evidence-based practice. And the one I really want to highlight is the primary, secondary, tertiary prevention Kahoot, right? Has anybody had a chance to watch that one? That's the one I would pull out and really, really, really watch, because that's your introduction to primary, secondary, tertiary. Okay. And that's one you're going to want to maybe review throughout the term. Okay. I already talked about NCLEX. No questions about content lecture. Study guide, after week 2, we should have everything covered. Oh, at the end of this week, you already got the schedule. We have our review sessions, live review sessions for exam 1, right? 2 on Friday, 1 on Saturday, 1 on Sunday. Okay, I do the Saturday one, but it's done by 4 different professors. It's all the same information, we just present in different ways. So hopefully you're planning on attending 1, 2, 3, 4. You will get the recordings. You know, we do 5 live reviews, but then we all share our recordings with each other. Okay, so you'll get all 4 recordings as well. Okay, so that is this upcoming week. Let's see. I did get information on the HESI study guide. I usually send it out in week 2 or 3. We are meeting to update the HESI study guide based on recent HESI information. We're not meeting until May 9th. So we're gonna have to wait. It doesn't make sense to send you out the old study guide now. We're going to be revising it. So you should hopefully be getting that like the 2nd week in May. All right, so you'll get that. I have reached out to all the students that I know about that are repeating. And so if you are repeating and we haven't talked, that means I don't know that you're repeating. So please reach out to me by email, or, you know, stay on after class, or let's see, let's get Gene. Get him in here. So please reach out to me. All right. So if we're already talking about it, we already have a plan. But if I don't know if we haven't talked about it, please reach out to me. For students that missed last week's class, there was a lot of going on. There was a lot of shifting of sections. For those of you that weren't in the live class last week, there's a second recording that you need to watch. Okay. So that would have been, you would have got that last Monday afternoon. So that was the orientation recording. So for those of you that are late, not by your fault, but by just switching sections, please make sure. So there's 2 recordings to watch for last week. The actual class lecture last week at this time, which was orientation PowerPoint and covering the class, and then the one I sent Saturday morning. So just as a summary, here's the way we do things going forward. Here's the way I do things. Here's the expectation. So I send you an announcement every week. Okay. It includes a summary of what we're going to cover. Okay. What's due and any additional information. There's 4 attachments that I sent to you. I send you the PowerPoints. I send you the case studies that I have through my teaching lesson. I send you the answer sheet for your practice application. That is a student activity in the book, every chapter. And I send you the answers to the student case study, which is in the chapter in the book. The expectation is that you at least review the PowerPoints, right? Prior to coming to class. Like, I don't know. Let's get Celine in here. Sorry. I don't know if you've reviewed the chapter 2 PowerPoints as of this morning. Or this afternoon. I have no idea. But those PowerPoints are your introduction to what we're going to be covering today. Okay, so I don't like to go back and review the PowerPoints. That's your summary of what we're going to be covering. I like to go into the book and show you the areas that the important concepts and topics that we need to pull out of each chapter. So those PowerPoints are your introduction to the week. Okay. And as we talked about, the PowerPoints are a summary of the chapter. Okay. And they're actually, the PowerPoints are actually outlined right at the beginning of the chapter, and I'll show you. So the expectation is that you review the PowerPoints and that you look at the case studies. I mean, we might not have time to get to the case studies, but those are a summary of what's going on in the chapter. They're excellent and they have great rationales. I'll show you, we'll bring up a couple of them today, but if we don't get to them in class, you have them to review them. And then those 2 student activities, the practice application and the student case study, it's up to you if you want to go through them in the chapter. I've provided you the answers so that you don't have to go back into your Evolve website and get all the answers, but those are just additional learning activities for you. It's up to you if you want to take advantage of it. Like I told you last week, I throw as much at you as possible, as many resources, helpful things, and it's up to you to take advantage of it. Make sense? So that's the expectation, is that the PowerPoints are meant for you to review ahead of time so you know what we're going to cover. I'm not even going to ask who's reviewed it and who hasn't, because, if you have reviewed it, great. You have a baseline of what we're going to be covering today. If you haven't, then everything today is brand new. So
you said they're under announcements, Professor.
What?
I can't find the PowerPoints.
They should be in your week 2 announcement at the bottom of all the attachments. Well, at the top of your week 2 announcement, it does say attached is, and I give you a long list of what's being attached. Did you guys get that?
It went all the way to the bottom of the announcements. They're like at the bottom, it says
Yeah.
week 2 for some reason.
Yeah.
Usually
your
when you
week-
post an announcement, it goes to the very top, like the very top of the page. And for some reason that one went to the very bottom of, like, it was near your first announcement that you ever sent. Like, it was at the very bottom of the page.
Can you guys click on the PowerPoints? I can't open anything up from that
Yes,
announcement.
They opened for me.
I had trouble with some last week, but I don't mind.
Do you guys, for all of you who are on the computer right now, if you just go into that week 2 announcement and just make sure, number one, you have it, and make sure you can open some of those attachments, because there was a lot. There was 4 PowerPoints, 4 case studies. There were 4 practice applications, probably close to 18 attachments. Make sure we can open these. You should be able to. Alex, are you seeing it?
Yes, ma'am. I got it. It just opened up.
Okay. All right.
Thank you.
Yep. Okay. So the week 2 announcement is usually a summary of what's in your module. I mean, I could say, go read your module. That's fine. You go read your module, but the week 2, my announcements are summaries of the modules. There should be nothing in the announcements that is, if you review the module, that's brand new. Make sense? Hi, Celine. Can you please turn your camera on? Hi there.
Hello.
So after going through all that, any questions? So again, expectation, review the PowerPoints, case studies. We'll get into the book. We'll go into a deeper discussion of what we need to pull out from the book. Okay. So that's all I had for housekeeping stuff. Any questions?
Yes, ma'am.
Yes,
For
go.
the case study that we're in groups for, that's due after the test, right?
Okay, so the groups that I sent you, that's for you. Have 2 group assignments. Okay, the first one is due in week 3. Right, so you should already be reaching out to each other. Your group has been assigned a case study, right? Either 1, 2, or 3, and you need to be working in your group to do your case study, and you'll turn that in next week. And there's specific instructions. You turn in kind of like discussion questions. You turn in your final product as a group. All of you have to turn it into the discussion post, right? That's where it goes in the feed. And it should be an attachment, right? When you do a discussion post, you can do an attachment. So that's where you put your final paper in or final. And then by Sunday, you have to reply to 2 other groups. Does that make sense? Did everybody got the group, right? Everybody got the group announcement with all your groups in there?
So are we in the same groups for
Yep,
the second?
yep.
The second group assignment also?
Yes, yes. So you can, last term I had a couple of groups that worked way ahead and got their second project done. The second project is it's infectious disease. So you can look ahead, see when that's due, because it gives you all the directions. What you're supposed to do is look on the CDC website, pick an infectious disease, and then shoot me an email of what you're going to do. Okay, so yes, you are working in the same groups for both those projects. Okay, this is group work. Alex, does that answer your question? Okay. Anybody else have any questions? Thanks for bringing that up, the group. So everybody got their groups, they know who they're in. You're not all from the same campus, which is fine. You should have everybody's email in your people section of your shell, so you can shoot your group members emails. And like people are doing right now, putting their numbers in the chat. And that's fine. That's fine. Okay. All right. So let's get going into this week's activities. Okay. I'm going to share my screen. We are going to go to, I'm not going to do that because we did that last week. Or that's on my, hang on. I know I have this up here. Okay. Let's see. We are going to chapter 18. Okay. Family assessment, family development, and family nursing assessment. Can you guys all see this? Yes, no, what?
Yeah.
Okay. So, as we discussed last week, we start with the chapter outline. This whole blue section on every chapter is a summary of your PowerPoint. Okay, this is your PowerPoint right here with obviously more information on your PowerPoint. Okay, so in your PowerPoint, family demographics. I think there's 3 slides in your PowerPoint that deal with family demographics. So your chapter outline is your PowerPoint. Okay. Second part. So look at all the things that this chapter is going to cover. Okay. And secondly, objectives. Okay, so objectives. These objectives are also the second slide in all your PowerPoints. The objectives in your PowerPoint are these right here. Okay, so as we talked about last week, or in my week 1 content, here's what you should be expecting. After reading this chapter, you should be able to, there's your objectives, explain the multiple ways public health nurses work with families and communities, identify challenges, and so on. Okay, that's the goal, right? You should be able to answer, explain, identify, describe these objectives. Okay. I do try and go through and highlight some words that are going to pop up that are part of this chapter that you'll need to know. And the nice thing is when you get to the key terms, you can just click on dysfunctional families. It will take you right to page 297. You can click on family health. It will take you right to page 297 or 294 or whatever it is. Okay. All right. So So I like to highlight the things that I already know from my lesson plan, the things that I want to cover and the things I want to bring out to you. So let's see. Family nursing in the community. So of course, the title of this is Family Development and Family Nursing Assessment. Okay, what things do we need to know about family development that are going to impact the way we provide our nursing care in the community? And then how do we do a family nursing assessment? Okay, remember in community nursing, our clients could be an individual that we're working with. Our clients could be a family we're working with. A client could be the whole population we're working with, or it could be an aggregate of the population, say the homeless, or the substance abuse, or the elderly, or the kids. Right. So what we're working with in the community can look very different. Okay. So family nursing in the community. So what are we responsible for? Okay. And those of you that want to follow along with me in the book, a lot of students do this and they just highlight what I've highlighted and then they go back and review it. Okay. So feel free to do that. You guys can see the pages that we're on. You can highlight it, take notes, however you need. But what I've highlighted is what we want to cover and I call it essential expected knowledge that you're expected to know. It's not the whole chapter, but we're pulling out important parts of the chapter. Okay. So what are nurses responsible for with regards to family assessment and family development? Helping families promote their health, meeting family needs, coping with health problems that may be new or existing, right? And then helping families with finding resources and establishing interventions that will work for them. Okay, if you think about family assessment, think of all the issues that can go wrong in a family, in the community, right? Gazillions, right? We have to be prepared to work with, it may be an issue between the parents, it may be an issue with one of the kids, it may be an issue with, extended family, it may be health, it may be economic, it may be social, lots of different scenarios of within here. Okay. Okay. Every family is unique. Every family is different, and every family is going to have their unique set of challenges. Okay. When we talk about family demographics, all right, family demographics is simply the study of the structure of families. Okay. So when we look at the definition of the family, okay, what does family refer to? It refers to two or more individuals who depend on one another for emotional, physical, financial support. Okay. There's two important ways to look at a family. We look at family functions and we look at family structure. Okay. Family functions we'll cover first. It's on page 295. Okay. So historically, families have performed in a variety of functions. For purposes of this book, there are 5 family functions that are summarized in the next box. So I just simply need you to know what these functions are. These make up every family. Okay. It looks different for every family, but these are historically the common family functions. What is the economic function of the family? What is the reproductive function? Right? What is the socialization? I couldn't get this to go yellow last night. What is the socialization? How does the family socialize within the community? What is affective function? Okay. And what is their healthcare function? Okay. So have a look at each of these. These are the 5 functions. Again, they make up all of your family, my family, your community's family, in some way. Some may be more important than others. Some may stand out more so than others, but this is the basic makeup of our families. We all have an economic, a reproductive, a socialization, affective, and healthcare function. Okay. And then families who performed all of these functions were considered healthy and good. This chapter discusses what is the difference between good family, bad family, dysfunctional family, functional family. There's lots of synonyms you can use, but basically this chapter breaks down what are the definitions, or what are the attributes of a healthy family. What are the attributes of a not so healthy family? Okay. They've also added a couple, these are historic functions. They've added a couple of, newer functions that have evolved, over time, and relationships and health. Okay, so the following are new functions are more prominent in the modern families: relationship function and health function. Okay. So those are the functions. Those are the makeup of the functions of the family. Now we go to family structure. Okay. Family structure is, what are the roles and responsibilities? What's our job? What's our job in the family? What's the family structure? I'm the mom, you're the dad, you're the kid, you're the dog, you're the grandparents. Okay. Defines the roles and positions of the family members. So just know the difference between family structure and family function. Okay. And think about it. What's the structure of your family? I guess you could look at it that way. What's the structure of your family? 2 parents, 1 parent, 4 kids, 1 kid. What's the structure? What are the roles and positions of the family members? Box 18.2 is a good summary of structure, different structures of the family. What could a married family look like? What could a single parent family look like? And again, if it's not highlighted, just things for you to take a look at, if you'd like, with regards to understanding this chapter in detail. I'm more focused on the highlighted parts, but there is useful information and resources within all these chapters. So what do these families look like? Okay. Family health. We talk about family health, right? What does family health look like? What does family non-health look like? What does resilience look like? Okay. So the biopsychosocial, cultural, spiritual approaches refer to individual members as far as the family as a whole, right? And individuals' health can affect the whole family, right? And in turn, the family's health as a whole can affect individuals, right? So when we're doing an assessment of the families, we're identifying the family as a whole, and we're identifying families at different members of the families to see how this all comes together, right? And here's our introductions to healthy and non-healthy, right? So health professionals have tended to classify clients and their families in 2 groups: healthy families and non-healthy families, right? Or those in need of psychosocial evaluation and intervention, right? So a popular term for non-healthy families is dysfunctional families. So now we're talking about healthy and not healthy, dysfunctional and functional. Okay, balanced down here, balanced and non-balanced. But the important thing is that you understand how a balanced family presents and how a non-balanced family presents. Okay. So box 18.3 is an excellent list of 12 characteristics of a healthy family. So have a look at this real quick, and then let's talk about what is the common theme? What's the common theme in these 12 characteristics? And again, like I said last week, I'm not going to listen to myself talk for 2 hours. I need you guys to participate. What's the common theme with all of this?
Trust.
What?
Trust.
Trust. Absolutely. Yes. Yes.
Communication.
Communication. Yep. What else?
So doing it together.
Who said, wait, what did you say?
They're all involved together.
Bingo. Alex gets the star for the moment. That is exactly what yay, Alex. That is a common theme from the perspective of this book about the most important characteristic of a healthy family. If you combine all of these, is they're one unit. They do everything together. They do everything together. And look at the 12. It says the family. The family shares a religious core. The family has traditions and rituals, not some or a few, all. Okay, so family communicates all well with each other. family affirms support for all of its members. So this isn't, okay, so take these and think of what a characteristic of an unhealthy family would be. So let's take number one. Some of the family tends to communicate well and some listen to others. Okay. Some of the families trust each other, some don't. Some of the families play together, but others are not participating, and humor is sometimes present. Do you get where I'm going? Okay, the family shares leisure time together. Some of them participate, some of them don't. Okay, religion. Some of the families are one religion, some are the other. And for purposes of this chapter, it's considered a unhealthy. Okay, so this is the characteristics of the healthy family, so you can tell what the characteristics of an unhealthy family are. It's separated, it's broken out to pieces. All right, really important to know that. Okay, families with strengths, functional families, and resilient families are often referred to as healthy families. Okay, we all know healthy families and we all know unhealthy families. Okay. So levels of prevention. Okay. I came up with the T. I came up with P is prevention, S is screening, and T is treatment. How's that? It's a good way for you to remember things. Okay. P is prevention, S is screening, T is treatment. Okay. And what we have within all of these three is education. So don't just, I said this, I think in my lecture, do not just consider education as in the primary prevention. All right. Education is involved at all three of these levels. So I don't want you to get tripped up with education, right? Education in primary is aimed at prevention. Education in secondary is aimed at early identification, early education to stop whatever's happening. Tertiary education is learning to live with something, educating, say it's a diabetic. They already have diabetes, so we're educating them how to take care of themselves. All right, they may already be obese. Now we're going to have to educate them on what are the risks of obesity going forward. Okay, makes sense? We have to understand primary, secondary, and tertiary. There's a half a dozen questions on each exam that are directly primary, secondary, and tertiary. And it could be from any topic, right? And as I said in my lecture, you're going to have this box is going to be in every chapter, okay? But the underlying definitions of primary, secondary, and tertiary are the same. We just have to apply them to different topics. Okay, so we're in family assessment. So what are the levels of prevention regarding family assessment? Okay, well, primary, educate parents about, you can read through this. I'm going to just go through this briefly, but educate parents about healthy nutritional choices for young children at the risk and the risks associated with obesity. Okay, you're trying to prevent obesity, right? Help mothers who qualify for the WIC complete the paperwork. Prevention, right? Secondary, screening, early identification, screen teens for obesity, right? Do kids' height and weight. Screening, we're trying to early identify potential risk. And then tertiary, right? Work with schools to improve the quality of food offered in their lunches. Help communities establish local networks, gardens. Okay, so here we're assuming that there are already issues maybe with obesity, and that we need to work with schools to improve the quality of food offered in school lunches. Does that make sense? Okay, we've already kind of covered this, but here's 4 approaches to family nursing. Okay, you just need to know what each of these 4 are and who they primarily address. So if we look at family as a context, we're looking at the individual first and the family second. So we're looking at the individuals within the family. So a nurse using this focus might ask, right? We're looking at the individual here. A nurse might ask, how has your diagnosis of type 1 affected your family? So we're looking at the individual, right? Second one is we're looking at family as a whole, as a client, and then the individuals are behind on that one. Tell me what's been going on. Tell me about what has been going on with your own health and how you perceive each family member responding to the mom's recent diagnosis of liver cancer. So we want the whole family. We're looking at the family as our client. How's everybody dealing with mom's diagnosis of liver cancer? Okay, then we could look at family as a system, right? How is the family interacting with the whole? Okay, so a nurse might ask, what has changed between you and your spouse since your child's head injury? How do you feel about the fact that your son has long-term rehabilitation and will affect the ways in which the members of your family interact? So we're looking at family as a whole unit. And then the last is family as a component of society. And simply that means, how does the family interact? How do they interact with the society? Are they or their community? Are they very private? Do they not have a lot of social interactions throughout the community? Or are they really involved? Are the kids in sports? Are they at the rec center? Are they in book clubs? Or how does that look? Okay. There are theories, family systems theories. There's one that we're going to go through. I think that might be in the next chapter. Working with families for healthy outcomes. Okay, so nurses need to use your communication skills to help families prioritize the issues they are confronting, right? So this is kind of the nursing, how do we apply ADPI into family assessment? Okay, we need to use our communication skills to help them prioritize the issue. First, we have to do an assessment, right? What are the issues they're confronting? What are their needs? What's the plan of action? How are we going to evaluate if that plan works? Again, take your hospital hat off today. We're out in the community. We're working with families. Okay. When we're doing, so this section is about it's about family assessments. We have to determine where we meet the family. How do we make the appointment with the family? Planning for personal safety. I want to highlight this. Yes, there's several parts about doing a family assessment, meeting with the family, but this is really important here on page 302. How do you plan for personal safety? Really concerned for community and public health nurses, right? It's a valid concern. All right. So it's critical to plan for your own safety when making a home visit, right? We need to know about the neighborhood that we'll be visiting. We need to anticipate the needs that we would have, whether is it safe to make a home visit alone, or do you have to arrange to have security with you? Who knows, right? Is your cell phone charged? Right? So obviously the most important thing is ensuring our own safety when we visit families. Okay, if there's going to be an issue. So I want you to review box 18.5. Okay, please know that. Home visiting safety tips. Okay, leave your schedule at the office, plan a visit during safe times of the day, dress appropriately, little money, little jewelry, avoid secluded places by yourself, obtain an escort if you need one. It's really important here. Why is this important? Sit between the client and the exit. Why is that important?
So if they have like any psych issues, you can escape.
If you feel unsafe, do not visit or leave immediately. And then here's something that's important. Check in with your agency at the end of the day. Why is that important? Not the beginning, the end. Why is that important?
So that your agency knows that you've completed your checks and that you're safe.
Yeah, and they already have a copy. You already up here, you're leaving a schedule at your office. I guess it's fine if you check in with them at the beginning of the day, but based on this, they're recommending that we need to check in with them at the end of the day for exactly the reason you just said. Okay, so no 18.5. Okay, this is kind of interesting. Box 18.6. How do you interview a family? Some suggestions of questions. What is the greatest challenge your family is facing now? Who's suffering the most? Now, this is a good way to establish a functional versus dysfunctional family. Okay, here's your case study right here that I've provided you. I call this your student case study because it's in the chapter. Okay, so here's your student case study if you'd like to do it. And like it says at the bottom, well, it doesn't say it here, but all the answers can be found on the Evolve website. I've already given you the answers. I sent them in your week 2 announcement. So again, case studies and rationales are always, for me, I will always push you towards case studies and rationales. I think they're an excellent source of learning. Okay, so there's your case study if you'd like to do it. Okay. Or is it this one? Case study. Wait a minute here. Is there 2 case studies? Yeah, there's 2 case studies. Okay, so you get 2 case studies in this chapter. Okay, and the answers I've already provided to you. Okay, so we've already started talking about a nursing assessment, but you need to be able to do a family nursing assessment just like you would do an admission to the hospital, right? Except we're in the community setting. So your ADPI is going to look a little bit different. So a family nursing assessment is the cornerstone for family nursing interventions, right? By using a systemic process, right, which is our nursing process, family problems are identified, family strengths are emphasized as building blocks for interventions, right? So when we're building the interventions with family identified problems and strengths, this allows for equal family member commitment. We need the family to be committed. We need all members. If we're working with a family as a whole, we need all members to be committed, not just a couple of kids and not one kid. Okay, and that's where you get into functional versus dysfunctional, as the whole family working as a unit after they've identified what issues there may be. Is everybody committed? Everybody committed to the solution. Okay. Here is your QSIN. Remember, we talked about this last week. There's 3 things that I really want you to look at in every chapter. Okay. I want you to look at the Healthy People 2020 box, which we haven't got to yet in this chapter. I want you to look at the prevention level box, right? Healthy People 2020 is going to give you goals and objectives based on the particular chapter you're covering. Your levels of intervention box is going to give you primary, secondary, and tertiary interventions for the topic we're covering. And then this QSIN, remember we talked about what QSIN is, the quality and safety education competencies for nurses. So what are we talking about in this particular chapter? The targeted competency is client-centered care. Okay, so I want you to read through. This is the 3rd thing I want you to read through in each chapter. Okay, Healthy People 2020, levels of prevention in your QSIN box. Okay. And this way we learn about what competency is being targeted in this chapter. And you go through the competency, and the 3 important aspects it addresses is knowledge, skills, and attitudes related to family assessment. Okay, and it gives you a scenario. Things to think about. Here's the family assessment model that I want to mention, the Freedmen family assessment model. Okay, so this model relies heavily upon that structure function framework we talked about earlier. What is the structure? What is the family structure? What is the family function? Remember, the structure is your roles and responsibilities within the family. Your functions are the makeup of the family. Okay. The model takes a broad approach to family assessment. It views the family as a subsystem of society, right? The family is viewed as an open social system, right? Remember the family structure, which is the makeup of the family, and the family functions. Okay, activities and purposes, reproductive, social, what was up in that box above, the 5 historical functions, and then we added a few more, right? And what is the family's relationship to other social systems? And that's part of the focus also of this assessment model. Okay, and then you could read this, it's on page 305. What are the guidelines for the Freedmen assessment model? Okay, it has 6 categories of interviewing questions. You can take a look at that. Okay. Here's our Healthy People 2020 box. Okay, what do we think it's going to give our goals and objectives to? Well, it's family assessment, this chapter, so their objectives are related to families and family nursing. Okay. And remember, I told you, you will get Healthy People 2020 questions in your exams. And simply, they're asking you to identify, specifically choose what the objectives are for Healthy People 2020. Not what you think is right, what I think is right, because these are 1, 2, 3, 4. These are 6 objectives. There could be 60 objectives, okay? But the questions in the exams relate to Healthy People 2020. What are their objectives? So, you know, you may want to put these in each chapter. You may want to put those on a little index card, right? Maybe 3 index cards per chapter. You do one with Healthy People 2020. You do one with levels of prevention with the topic highlighted at the top. And then maybe with regards to QSIN is what competency are they targeting? Make sense? So take a look at these. Let's just go through the first one. We're talking about families. Increase the proportion of parents who use positive parenting skills and communicate with their healthcare providers about positive parenting. Why is that important in family assessment to know? Does that determine maybe the difference between a functional family and a dysfunctional family? If a parent is using positive parenting skills and communicating with their healthcare providers about positive parenting, that's good. Right? Increase the proportion of adolescents who talk to their parent about reproductive health. That's a good thing. So this is their goal. These are the Healthy People 2020 goals. Okay. Any questions? Any questions on that chapter? Family development, family nursing assessment. So let's move to chapter 19, family health risks. I mean, are there like a gazillion family health risks? Absolutely. I mean, we don't even know where to start. The risks that families face. Okay, so let's jump into here. Again, here's your chapter outline, which is your PowerPoint. Your PowerPoint is this chapter outline with additional data. Okay, and then your book is the chapter outline, your PowerPoint with additional data, and the book has much more detail. So all 3 are connected. Okay, so your chapter outline and your PowerPoint should be the same. And then when we go into the book and we'll start covering the chapter outline. Okay, again, objectives, they're the second page of your PowerPoint. After reading this chapter, you should be able to, okay, analyze, determine, understand, explain, discuss, right? Analyze various approaches to defining and conceptualizing what's family health. How do we determine the major risks of family health? And so on. Understanding the interrelationships among individual health, family health, and community health. Remember, we're looking in the community, our client may be an individual. It may be right here. It may be an individual, it may be a family, or it may be the entire community or a subset of the community. Okay, Discuss it here, discuss policy implications of policy and policy decisions on the family. Okay. So again, I highlighted a couple of words that are going to come up that we'll talk about. But let's go. Let's get going. Okay, early approaches to family health risks. Health of families. Historically, studies have found studies of the family in health and illness focused on the three major areas. What is the effect of the illness on the family? What is the role of the family in the cause of the disease? And what's the role of the family in its use of services? Okay. And I like this little summary here. The energized family is characterized as one that promotes freedom and change. It's actively engaged with a variety of other groups and organizations. It has flexible role relationships and an equal power structure, right? And the family members exhibit a high degree of autonomy. Okay. So anyway, that's a nice summary of working with functional versus dysfunctional families. Okay. Here we talk about risk. Since we're talking about family health, what's your definition of risk? What's risk? What's risk? What's a risk? We take risks all day, every day, 24/7. What's a risk?
It's an action with a uncertain outcome.
Right. The concept of risk, which refers to as a factor predisposing or increasing the likelihood of something, ill health, whatever. It's a risk. It's important to pay attention to the environmental and behavioral factors that lead to ill health. Okay. Our goal is to reduce health risks. Okay. That's a major step in community nursing, a major goal in community nursing. We want to reduce health risks. Okay. So right off the bat here, we get our Healthy People 2020 objectives. Okay. This chapter is related to family and health. Okay, so 2 simple objectives: eliminate very low food security among children in the U.S. households, and increase the proportion of smoke-free homes. Those are their 2 objectives in this chapter. What are the concepts in family health risk? Okay, there's several. Okay, first we talk about family health, right? So family health is defined in terms of a system stability, and it's characterized by 5 different factors. Okay, and the 5 different factors are right here. Okay, this is how we determine the health of a family: physiological, psychological, it's all right here, page 312, sociocultural, developmental, and spiritual. Okay, so the family is seen as a whole system with all these 5 interacting factors. Okay, that makes sense, right? If we're looking at a family and trying to assess their health, we're going to be looking at physiological aspects, psychological aspects, sociocultural, developmental, and spiritual, right? And here on page 313, it gives you a little synopsis of the 5 variables. Okay, and it gives you right here, if you start here, the Harris family. So it gives you a scenario. The Harris family, here's their issue. Okay, and then it shows you how the Harris family is going to be assessed with all these aspects. Okay, so have a look at that. Then we talk about health risk. All right, so several factors contribute to the development of a healthy or unhealthy outcomes. We're all exposed, right? We're all exposed to certain things at certain times. right? Those determine whether we have mild risks, increased risks. I think of COVID, right? Think of COVID. What population and where were the most at risk populations? Who were they?
It was the low income and the medically fragile.
Yep. And I think about the elderly as well, right? So what about long-term care facilities? What about assisted living facilities? Their risks were much higher than the kids in schools or the normally healthy person that walks around. But what about all the people that were immunocompromised? Right? Risks are different. Risks look very different with everybody. Okay, how do you do a health risk appraisal? Right? Assessing for this is all about the nursing process. This is the assessment part, right? We're assessing for the presence of specific factors that are associated with risk. The likelihood of illness, cancers, the likelihood of, if we don't talk to kids about they're learning how to drive about seat belts, then their health risk goes way up. If we don't try and educate in elementary school about the risks of drugs or obesity, right? Health risk reduction, right, is based on the assumption that we try and decrease the number of risks, right? We try and minimize the risk that something will happen. So if we can do that education with the elementary school kids about the risks of obesity and the potential health issues, maybe that's hopefully part of our risk reduction. All right, and then we have to deal with family crisis. What does a family look like that's in crisis? Right, a family crisis definition occurs when the family's not able to cope with an event and becomes disorganized and dysfunctional. Okay. Family crisis exists when the demands of the situation exceeds the resources of the family. Maybe they're trying to manage it within the family, and whatever issues they're having, they need to reach out to public health nurse, community health nurse, and need resources. Maybe it's an addiction and the family's tried everything with a particular family member to deal with it and they can't. Now they have to reach out and find some resources to help the family. Okay, so you have to be able to recognize what a family in crisis looks like. I think about the elderly. Let's say somebody's been married, they've been married for 70 years and one of them dies. How do you help? I mean, obviously the living spouse is going to be in crisis. How do you identify whether he or she is trying to move forward or whether they're still living in crisis? Are all the clothes still in the closet a year later? Nothing's changed in a year? Well, they may need some additional support to help them move along. Okay. Family crises can look very different, and they will look very different. They're very unique in every family situation. That's why I said in one of my recent lectures that as a community nurse, you have to bring everything to your job. You have to bring leadership skills, communication skills, mental health, what you've learned in mental health, what you've learned in foundations, what you've learned in med-surg, what you've learned in geriatrics, infants. Okay, so major family health risks and nursing interventions. So as mentioned before, the three major areas that health risks is going to come from are biological, hereditary, age-related risks, environmental, and behavioral risks. Make sense? They're all going to come from one of those. Okay. And then it gives a little summary of Healthy People 2020, even though the box is way up above. But it targets in areas of health promotion, health protection, preventative services, and surveillance data to describe age-related objectives. Okay, so have a look at this. Physical activity and fitness, nutrition, tobacco, alcohol, other drugs, family planning, violence, mental disorders. These are all included as potential risk factors that have to be addressed in the health promotion, right? The other things we need to look at is prevention of injuries, intended, unintended, occupational safety injuries, health, environment, food, drug safety, oral health. I mean, we're just going through where all these risks can come from, and there's many. Here's some good definitions. Definitions related to family health. What are determinants of health? What did I say last week? A determinant of health, it's a fancy word, determinants of saying what determines health, right? So an individual, here's your 4 areas. An individual's biological makeup influences health throughout interactions. Let's say you come from a long line of families with cardiac issues and heart attacks. Okay, you subsequently will have an increased risk, right? Behaviors, these may be learned from other family members. Social environment. We have to think culturally, language, personal, spiritual beliefs. Okay, and then physical environment. Are there hazards in the home may affect your health? I mean, are you in an older house that might have potential lead exposure? Do you live near a highway that might have potential air quality exposure? Right? Do you live in a, I don't know. I mean, wherever your physical environment is, everything comes with different risks. So there's your 4 major areas related to family health that we need to be able to assess. Okay. And then it goes through each one. If you want to read through each one of them a little bit more in depth, they're right here. Okay. Biological and age related. Here's your case study to go through if you'd like to. Okay, here, how do you do a biological health risk assessment? Okay, here's what we get into is we have to know the difference between a genogram and an ecomap. Okay, a genogram involves the biological health risk assessment. So that's your genetic testing, right? So this is, we go back. One of the most effective techniques in assessing for patterns of health and illness is called a genogram. You need to understand that. Okay, a genogram, and there's a picture of it right here. Okay, and so I'm going to use my own personal experience, okay, in a minute, but briefly, a genogram is a drawing that shows the family unit of immediate interest that includes generations. So what happened to 3 or 4 or 5 generations going back? Okay, so for example, for me, I was diagnosed with breast cancer a couple of years ago. No family history, Zippo. Okay, we have everything else, but no breast cancer. So they had to go back and do a genogram for me, with me. And I had to talk to my parents, and they had to give me information on my grandparents. And we had to go back and figure out who going back 3 generations had any kind of cancer. Prostate cancer, cervical cancer, lung cancer, breast cancer. And so they did one of these for me. Okay, so it was myself, my parents, we went back 3 generations to try and figure out where this came from. Okay, and then because it was unknown, then I was recommended for genetic testing. Okay, so if they had come up on the genogram and said, hey, okay, it makes sense, it probably came from, but my genogram didn't know, didn't indicate anything. And so I had to go for genetic testing. All right, so the 2 things you need to know here, genogram, okay, that's the biological assessment. You're going back and looking at family risks. Okay, so let's say Alex, for example, had a heart attack. which you won't, but let's just say Alex did. But Alex has no family history of a heart attack. So his doctors want to know where that happened. Where did that risk come from? So they're going to ask Alex, they're going to interview Alex and do a history. That's a genogram. Alex, talk to your parents. Alex, let's figure out where your grandparents, who died from what? Was it cardiac? Was it cancer? Was it whatever, accident? Okay. And I'm only picking you, Alex, because once I share my screen, I can only see 3 students, and I can see you and Jamie and Gabrielle. That's all I can see is you 3. Okay. So that's what a genogram is. To take it further, who should be recommended for genetic testing? Okay, because genetic testing is really safe for the unknown. So if something happened that was unknown or unexplainable, that's genetic testing. So for example, if I have a family history of alcoholism, okay, I already know I'm going to be predisposed. I already know my kids are going to be predisposed. We don't have to go do genetic testing for that. Okay, we already know we're predisposed. If all of our uncles died of heart attacks, we already know we're predisposed to cardiac issues. Okay, but it's good to do the genogram, right? But not everybody needs genetic testing. Does that make sense? Okay. I really want you to understand that because you'll be tested on that difference between genogram and ecomap. And, you know, every time my students get it wrong, every term, I keep thinking, I have to explain it better. I have to explain it better. So, okay. So anyway, that's the genogram. Then, and here, okay, here's your genetic testing, page 318. All right. So genetic testing, like I said, is not for everybody. Okay. There are certain indicators that you should go and get genetic testing. It's primarily used for the unknown. Okay. So here, as mentioned, genetic testing decisions are personal and complex and can be controversial, leading to a conflict and confusion in families. I wanted to go personally to have genetic testing because I wanted to see if I was carrying that link so that I could let my daughter know. Okay, but other people don't. And that's part of ethics in nursing, right? It's important for nurses to respect individuals and family members' decision-making process. They must at some time be well informed about genetic testing to provide accurate education to members of the public to support decision-making. And that's for the unknown. So did I want to know? Yeah, I did, but I don't know. Jamie may be in the same boat as me and she may not want to know. That's her decision. Okay, but what we need to recognize is if Jamie's family had a long history of breast cancer, well, we know everybody's going to be, all those females are going to be predisposed to it. So Jamie may not need to go get genetic testing because she already knows her mom doesn't carry that genetic link. Okay. All right. Let's talk about, there's a biological risk, which is your genogram, and there's an environmental risk, which is your ecomap. Okay. Simply stated, an ecomap is what is your social connection to the community? What is with the importance of there's social risks. Okay. The poor are at a greater risk for health problems. Economic risk, which is related to social risk, is determined by the relationship between the financial resources of the family and the demands of those resources. Okay. So one of the things I'll mention here is, and we're going to talk about this all through this term, is the economic stability of a family is the key driver for assessing risk, health risks. Okay? Remember that. Poverty, economic risks determine kind of everything, right? They determine your health. They determine your school. They determine your food. They determine your clothes. They determine your, they have an impact. If there is financial instability, that has a ripple down effect to everything. Okay? Having adequate financial resources means that the family does have access to necessary services and goods, right? Housing, I just said housing, clothing, food, education, health or illness, right? The amount of money that a family has available is related to a few things: situational, cultural, social, right? A family may have income well above the poverty level, but because of devastating an illness, they can't meet their obligations. Okay, so how do we do an environmental risk assessment? Okay, this is called a ecomap. All right, so again, defined by social risks. All right, so information. So what is the relationship the family has with others, such as relatives, neighbors? What are their connections with the community, church, school, work, clubs? What is their flow of energy? Is it positive? Is it negative? Are they outgoing? Are they extroverts? Are they introverts? Right? And right here, this can all be assessed through the use of an ecomap, page 320. Okay, an ecomap represents the family's interactions with other groups and organizations accomplished by a series of circles and lines. So here's what an ecomap looks like. Okay, so this used to be, again, I'm going to make it personal because I am determined for you guys to understand this. Let's say this is my ecomap. Here I am, smack in the middle, my family. Okay, I have relatives, I have book club, I have church, I have on and on. These are all the social connections, okay, that I do. So I'm well connected to my community. Okay, I like to be part of everything. Okay, I want to be on the city council. I want to be this. I want to do that. These are all the social. So this is extremely healthy. Okay, what happened when COVID hit? I'll tell you what happened to my social network, my ecomap. So my ecomap then was just a single circle, right? So we cut out everything, right? We cut out everything. We cut out all of our social connections. We couldn't visit family. We couldn't go to the rec center. We couldn't go to church. We couldn't do anything. So a lot happened in the last 2 years. I'm starting to build all these back now, right? Because things are opening up and whatever. But think about it. Some families, it may be just a circle. Okay, that potentially is a problem. You know, if you've got just a circle and you've got kids in there, where are they getting their social interactions? What's happened to kids? What's happened to our adolescent and teenagers who went from having a ecomap that looks like this to a single circle? What happened when all their social connections were gone? What happened to these kids? What are we seeing? What are we seeing now?
Everybody's an introvert. Nobody wants to do anything.
Yeah, depression, drug use, alcohol use, no social connections, mental health issues, suicide. So what you want to see is a healthy picture like this. That's what you want to see. So that's part of your family assessment.
Did a
Okay,
lot of developmental delays in some of
absolutely.
the young children.
Yeah, they were at home working on school. Absolutely. So do you guys understand the difference? Okay, so support networks or ecomaps are about support networks, neighborhood, community, family lives. You can keep reading on about that. Okay, we've already said that economic risk is the key predictor of health. That's just the way it is. Remember that economic risk, financial stability is a key predictor of health. Okay. Okay, you can go through and read about behavioral risks. Okay, I want to cover environmental and biological since that has to do with the genogram and the ecomap. Okay. Here's another little subset of dysfunctional functional. The literature consistently identifies the following family factors that decrease the risk of family substance abuse. And this is in the behavior section. Okay, so what does the literature say are the three most important factors that decrease the risk of substance abuse? Family closeness, families doing activities together, and behavior modeled in a family. Page 322. Okay. How do you do a behavioral risk assessment? Okay. Right here, you can read about that. I want you to focus more on the biological and the environmental. Behavioral is important, but I want you to focus on those two. The behavioral you can read through. Okay, nursing approaches to family health risk reduction. Big, home visits. We say in public and community health, home visits are the most important aspect of gathering information. Think about it. Let's say you're going into a home to do wound care. What else can you look at? What else can you assess? Safety, relationships, cleanliness, environmental risks, physical risks. What else?
Nutrition.
Nutrition.
Support systems.
Support systems. Absolutely. Home visits, to be in there, you can, even if you're in there for one reason, you can assess 20 other reasons. Right? Okay. You need to know this. What are our phases of the home visit? Okay. And again, when you read through this, think about ADPI. Okay. Assessment's going to look different admitting a stroke patient to the hospital than assessment of a home visit. What's the assessment phase of the home visit look like? Yes, we have initiation, pre-visit, in-home, termination, but all in here is your ADPI. Part of your assessment. Okay. So we need to know what the phases are. There's 5 of them. Okay. So please note table 19.2. And then it goes through all the phases in depth. If you need more information than this, you then the rest of the detail is below. Okay. So this talks about the initiation phase, and there's a nice box on how to prepare for the initiation phase. Okay. What's the pre-visit? Okay. The one thing to remember here in the pre-visit as you're preparing is home visits typically can be, they're either voluntary or involuntary. Voluntary is typically requested by, I don't know, maybe a new mom who wants help breastfeeding or wants help, bonding, whatever. Okay. It's usually initiated by the client. However, here it is. For example, a voluntary visit would be new mother's request for the nurse to come over and help her with breastfeeding. In contrast, client may feel little need for required home visits, often legally mandated. So that's the other part. So when the home visit is involuntary, people are going to have a heightened sense of, what are you doing here? I don't want you here, get out. Okay, but often these times it could be a welfare chat, could be a child abuse report. Okay, it could be somebody who's been diagnosed with TB and they have to take their medication. Well, part of public health is if you have somebody diagnosed with TB and they have to take their medication, you have to go visit them to make sure they're taking their medication. Okay, well, what if there's a cultural issue? What if there's a language barrier and they don't understand why you're there? Okay, so again, using our excellent communication skills to try and, especially with these involuntary visits, how are you going to deal with a mom somebody's reported her? for potential neglect, and somebody visits, you visit her house, or you visit with a police officer and visit her house. How do you think that's going to go? Okay, so those are things we have to think about. Oh, here's the example. Example of required visit might be when the family member has been diagnosed with TB and you need to verify that you're taking the medication. They may not know what TB is. They think you're there to, I don't know, do something negative, but you're simply there to make sure they're taking the medication. So maybe you use that opportunity to say, oh, well, here's what TB is. Here's what the medication is. It's okay. You don't have to worry that, just trying to, I guess what I'm trying to say is, with involuntary visits, we really have to pull our good communication skills out. We have to pull our, very non-threatening dialogue, words, right? We're trying to establish trust. Okay, so your pre-visit phase, as you're assessing that, could potentially include, you will have to assess whether it's a voluntary, involuntary visit. Then you have your in-home phase, and box 19.2 goes through what are some reasons for a home visit. And here's some reasons. What I need you to know is just the phases, but if you want to get in the phases and what they entail, okay, all this extra detail is great. It just helps explain in detail what certain things are about. Here's your QSIN competency box. Okay, so what is the targeted competency here? Safety. Why? We want to minimize the risk for harm to clients and providers to both system effectiveness and individual performance. And why is safety important? And it goes through knowledge, skills, attitude. And here's your safety question. So read through these. They're excellent, excellent, excellent. Okay. And then it goes through the termination phase and the post-visit phase. But again, read that box way above all of this, and just be able to apply your ADPI to a visit. Which part is the assessment phase? Well, let's go back. Let's go back to this. Where's your assessment in here?
Your assessment's going to be in your in-home.
Okay. Where's your diagnosis? Probably in-home, right?
I was going to say your assessment would be in the initiation.
I mean, your assessment is a little bit of it's in the initiation, pre-visit. How difficult is it to schedule a visit? If it's really hard to schedule a visit, like one of those involuntary visits, well, that's part of your assessment, right? You may have to reach out to a family physician or somebody else to say, hey, they're not scheduling a visit with me. This is part of the assessment. This could be more difficult than we had planned. So be able to see how your ADPI fits in here. I don't need you to say ADPI is specifically initiation, diagnosis specifically. I'm just trying to show you that your ADPI is applied in community health. Okay, so this is how when you schedule a visit or try to schedule a visit, this is how your ADPI is applied. It's applied in 5 different phases. Does that make sense? Okay. Where are we now? We went through that, reasons for a home visit. We went through QSIN. How do you contract with families? Contracting, what's contracting? Mutual, right? What do we know about contracting? Contracting is making an agreement between 2 or more parties. Okay, that's what a contract is. Okay. Just have an understanding of what a contract with the family is. What are the purposes of it? And what's the process? And again, table 19.3. This is an excellent summary of the 3 phases of contracting. Again, try and apply your ADPI. Beginning, working, termination. Well, your beginning phase is assessment, diagnosis, planning, maybe a little bit of implementation. Your working phase looks to be more of implementation. Maybe your termination phase is your evaluation. Again, I'm not saying it's one for one. I'm just saying have to be able to read into all these activities. Is this an assessment task we're doing? Is it a planning task? Is it an intervention task? Okay, so there's your 3 phases of contracting. Okay, here's our levels of prevention. Again, we're in we're family risk chapter, so it's related to families. Okay, so here's a primary. Complete a family genogram and assess health risks with the family to contract for family health activities to prevent diseases from developing. Why is that primary?
Because we're trying to prevent it by screening it.
Exactly. Right. Exactly. Why is use a behavioral health risk survey to identify the factors leading to health problems, such as obesity? Why is that secondary? You guys need to understand this. Why is that secondary?
Screening process.
Right. A survey is screening, right?
I had a question about all that. So like a self-breast exam, would that be primary? Or because we're say we're teaching them about it to
How to
prevent
do it.
That,
You're teaching
that
them
would
how
be-
to do a breast self-exam. That's obviously primary, right? Because you're trying to prevent anything. You're trying for them to be proactive. Now,
And
let's
then
say they, let's say like me, I've already had it. And so for me, I would kind of fall into that secondary that I'm doing them monthly because I'm at risk. So the oncology nurse would teach me how to do it because I'm at risk. They want to make sure that since I only see the oncologist every 6 months, I want to make sure I'm doing everything in between. Right? And then tertiary, let's use my example. I have it during the time I had it. Okay. They were trying to work with me. Well, number one, we had to get it out and, radiation, all that stuff. So there were all those phases for me when I was going through my own breast cancer. Does that make sense? Do you guys understand that? I know I'm using personal examples, but I'm just trying to, you guys, we have to have an understanding of primary, secondary, and tertiary. All right, so let's look at this example under tertiary. Develop a contract with the family to change nutritional patterns to reduce further complications from a specific health problem. So let's say the family's obese. We are now developing a contract with the family to change nutritional patterns to further reduce complications. So that's treatment, right? So P is prevention, S is screening, T is treat. Okay. Here's your practice application that I send you the answers to. Go through that as well. Okay. So that is a summary of chapter 19. I want to focus on 20 because there's a lot in here. This is what I was talking about last week. Okay. You are going to be taking care of families across the lifespan. Right? So you need to know the health risks associated across the lifespan. That's what this chapter is about. Okay. Again, your outline is your PowerPoint. Your PowerPoint has additional information. So if it says obesity, it's going to have a slide with information on obesity. If it has, target areas, anyway, your PowerPoint is a detailed chapter outline. There we go. I finally said it right. Your PowerPoint is a detailed chapter outline. Look at all the things that are covered in this chapter. What are the major public health issues with kids? Obesity, injuries, accidents, mental health, acute illnesses, chronic health conditions, right? Where do we want to focus with these target areas with kids? Smoking, nutrition, immunizations, environmental health hazards, Read through this outline. That's what the chapter covers. Right? What are some health policy, legislation, and ethical issues related to adult health? So kids, we're talking about up here, smoking, nutrition, immunizations, environmental. Now we're into the adults. What are some ethical and legal issues? And legislation for adults and older adults? What are some major health issues and chronic diseases? And how do we manage them across the lifespan? Okay, what are chronic diseases that we're concerned about? What are women's health concerns? What are men's health concerns? And then we have specific populations that are predisposed to health disparities, which means there's a different way that they have access, the resources they have. We talk about adults of color, incarcerated, LGBT, adults with physical and mental disabilities, frail. And then what do we do with family caregivers? Right. So this is health risks across the lifespan. So that's what that outline is about. And then again, after reading this chapter, you should be able to discuss major health problems of children and adults, describe nursing measures to promote child and adolescents health within the community, describe risk factors for older adults. Okay. Okay, I'm going to go through this quickly because we're at 2:30, and I'm going to go through this quickly because I do need you to review it. Okay, so we're talking about children's health issues, obesity. Okay, this whole section is about obesity. I need you to know box 20.1. These are family recommendations as you're working with families of obese children, or they have, obesity prevention. All right, they're not obese yet, but here's some family recommendations when you're talking with families. Okay, do we want them to fry their food, or do we want them to bake their food? Bake's the right answer. Do we want them to give them 100% sugar fruit juices, or do we want to look at other alternatives?
Alternatives.
Right. Right. Okay, so read through these. Oh, here's my bake, broil, fry. Right? We want to bake. Right? Low-fat food choices, using the food pyramid. Okay, decrease salt, sugar, fat. Okay, injuries and accidents. We've got to learn. We need to know what these kids are at risk for. Injuries, accidents, the most common and preventable disease, disability among kids. What's an unintentional injury? Right? Might be an accident, might be a fall, fire, drowning, suffocation. I think about babies, SIDS. It's on your study guide. I think the first party study guide talks about the risks of SIDS. Right? What about kids when they start driving? Leading cause of unintentional injuries in children in motor vehicle accidents: suffocation, drowning, poisoning, fire, and falls. Okay, here's a nice summary. Table 20.3, leading causes of number of non-fatal unintentional injuries among children. What I need you to know is, breaking out each group, what is that age group at risk for? Okay, we talk about infants. SIDS is a major. We talk about, kids when they start driving, motor vehicle accidents. The younger kids, safety, falling off their bikes. They need to wear helmets. Okay, so you need to have an idea of what are prevalent unintended injuries within these groups. Okay. CUSIN in this chapter, your targeted competency is client-centered care. Why? Tells you exactly why. Okay, so again, it's not so much you have to memorize anything in these books. In this book, it's more about applying this. So when you're learning about the client-centered care competency, if you go back to chapter 1, there was a book that listed out the 5 or 6 competencies. That's what all these are targeting. Right? Guys, remember that? Go back to chapter 1 and review where we got client-centered care. Where do we get safety? Where do we get, it's all in chapter 1. They give an introduction of these CUSIN boxes. There's six different competencies. And they're all addressed throughout each chapter. A different one is addressed in each chapter. Okay, and here's all your groups starting on page 337. Okay, developmental considerations. We're on unintentional injuries. Infants, toddlers, school-age children, adolescents. How do we do injury prevention? Okay, box 20.2, a great topic on injury prevention topics. Poisoning, preventing falls, preventing poisoning, bike safety, sports safety. Okay. Playground safety. What do you need to know for playground safety? You're the community nurse and they've reached out to you and said, hey, we're going to be building this we got this grant. We're going to build this new great big playground, but we need your input. What's safe and what's not safe? Are you guys, is your mindset out in the community yet? Or are we still in the hospital? We're out in the community. This is all stuff that happens in the community that we need to know. Right? You may be on the team that develops a new playground. You may be on the safety team. So you got to know what things are good, what things are not good. Right? So believe it or not, we're talking about playground safety. Okay? Gun violence. Big problem. Right? How do you educate families about gun violence? You know, when you go to do a home visit, what's the first, when you do a home visit, what's the first thing you ask the family? Do you have any firearms? Yep, we do. Okay, can you show me where they're located? We just want to make sure they're stored and locked adequately. This kid's in the house. That may seem intrusive. However, that's part of your assessment. Right? I mean, we don't want to get somebody upset and their guns open and unlocked and God knows what would happen. It's the first thing we have to establish with gun safety in our home visits. Do you have any firearms in the house? Yes. Where are they? Please show me where they are. I just need to assure they are locked and stored safely. Okay. So you have to read through this. You need to read. So you need to read through this section on gun violence. Okay. And then we have behavioral problems. Okay. Again, this is health across the lifespan. Behavioral problems in kids and adolescents, eating disorders, attention, ADHD, substance abuse, you know, kids still with bladder and bowel issues in school, conduct disorders, sleep disorders, anxiety, autism, depression, bipolar. Being in the schools for 20 years, I've seen it all. Right? And a school nurse is a community nurse. So, you know, I really want to get to my little passion, which is chapter 31. All right. Illnesses, acute illnesses. What do we have to know? There's a whole section of this on your study guide. Right? We need to know about lice. We need to know, what do we do with lice? What do we do with conjunctivitis? Can you recognize conjunctivitis? Can you recognize lice? What do we want to teach the families? I mean, we may be teaching families things as basic as correct hand washing. Right? What do we say in the school nursing? The best universal precautions. The best practice against passing on germs and bacteria is washing your hands. We talk about that with kindergartners on a daily basis. Okay. Chronic health conditions. Okay, now we're getting in towards the adults. Well, no, actually, this part is still in the kids. So chronic health conditions within the kids. Down syndrome, spina bifida, CP, asthma, ADHD, diabetes. We take care of all that in the schools now. And you're going to be participating in taking care of kids like that in the community. Are the parents equipped to take care of them? Are they not, can they get, you know, let's say a kid with severe CP has all these appointments, OT, PT, speech, everything. Is the family equipped to get them to all these appointments? Can they schedule the appointments? Right? Can the family care for a highly impacted child, or can they not? What resources can you help them with? Okay, lots of things to think about, right? And here's my example. All children with chronic health problems need routine health care. Can the family handle it? Do they need help? If they need help, what do they need help with? Okay. Asthma. Asthma is big chronic disease within kids. How do we manage asthma in the community? How do we manage it in schools? Right? What if you're in a house that reeks of smoke and there's kids with asthma? What are you going to do? Obviously, your end goal is a smoke-free house, but how are you going to work with the family for your end goal of a non-smoking house? Right? Here's a whole bunch of suggestions right here. You may get asked, hey, listen, what would be a concerning or supportive statement that the parents would say when you're working with them about smoke-free? What if they say, oh, don't worry, I've cut down from 2 packs to 1 pack. Is that good? No, they're still smoking in the house. Right? What if they say, oh, I vape now. I'm cool. I vape now. Is that good? No. What if they say, oh, I took my smoking from inside and went outside? Okay. That's something I can work with. It's better. Okay. So understand that. Read this section on asthma, 341. And here's your smoking. All right. Here's what we just talked about. Okay. Read this section on smoking. Okay. Here's some interventions to discourage smoking. Right? Maybe we offer parents educational programs dealing with the negative effects. Interventions to stop smoking. Maybe we offer them treatment programs. I don't know. How do they create a smoke-free environment? Behavior modification techniques. The end goal is we've got to get them, an asthma kid cannot be in a smoking house. I mean, they're much more at risk for future problems. Nutrition, immunizations. What do you do with the family that says, no, I'm not into immunizations? It's my culture. It's my personal preference. It's my choice. What do you do? Right? Obviously, the goal is immunization of everybody. But what if they're not going to be immunized? What steps do you take? Do you educate them on, the risks of not being immunized? What are you going to do? Read the section on immunizations. You might be faced with that. A lot of cultural preferences out there, and a lot of kids are not immunized. And what about the kids that live in the inner city and they don't have a lot of immunization resources, or they can't get to a free clinic, or the parents don't want to take them? What do you do? Okay, we need to know this. There's 5 examples of federal legislation. You just need to know what each of them do. Okay, and it's right. There's a box, but here's what they are. The Patient Self-Determination Act. It says, we want patients to have a say in what they want. If they are competent, they need to participate in their care, right? Nobody's going to take it away from them. So we don't want anybody starting to manage their finances and manage what they're doing. And if they're fully competent to do it, we want them to do it. Okay. We have the Older Americans Act, which is legislation to support the elderly. Okay. Older Americans Act. We have the ADA, American with Disabilities. We all know what that is. Protects Americans with disabilities. Patient Self-Determination Act. If they're competent, they participate. And then we have the Family Medical Leave Act. Okay, I can take time off to care for a family member. And then the personal responsibility and work opportunity. I'm going to take you, I want to go to a box here. Here's a summary of older Americans. Here's a summary of ADA. Here's a summary of Patient Self-Determination Act, right? Family medical leave, personal responsibility. There is a box, I swear. Where is it? There's a box that goes through all 5 of those. But you need to know what the 5 important pieces of legislation are. And if you were asked a question, here's your scenario, which one is it? You just have to pick out which one it is. So if it's a scenario about somebody having to take off time to care for a parent that was just diagnosed with cancer, what would that be? Family medical leave. Okay, so just know what each of those are. And here's where we start to talk about ethical and legal issues for older adults, right? Because here's where we introduce elder abuse. Right? Remember what this chapter is: health risks across the lifespan. When we get to the elderly, we think elderly abuse. So have a look at what is elder abuse. What does it look like? Willful infliction of physical pain or injury, mental abuse, theft or mismanagement of money or resources, right? How many horror stories have we heard of that? Unreasonable confinement and deprivation of services. Okay. And then one of the things, here's another no-brainer, or another you have to remember this. The biggest issue we have in community health right now is the ongoing chronic illnesses. Chronic illnesses are the biggest part of community health. Okay, what do we need to know with a chronic illness? What are we trying to do? I want you to read this section right here. With chronic illness, we are trying to maintain dignity, maintain independence, right? Having the client participate in as much of the care as possible. Okay, trying to help them with goals, self-improvement, self-care, manage the disease, help them with healing abilities, prevent complications, right? Try and maybe delay deterioration or decline, maybe to achieve the highest possible quality of life for the situation they have going. What can't we do with chronic illness? Really important. What can't we do?
Can't cure it.
Exactly. Can't cure it and can't prevent the death. Okay. We want them to be able to try and die with comfort, peace, and dignity. Okay. You're going to be on your own now. Healthy People 2020. You're going to have to read through that. Right. And so what do we just talk about? Chronic disease of adults. So their box here is related to chronic disease of adults. Okay. Read through that. You don't need to know. I mean, don't need to worry about that. Here's our prevention. What are we doing? Their prevention levels regards to cardiovascular disease in women, because health across the lifespan, women. Collaborate with organizations such as the American Heart to design and implement interventions to reduce a woman's risk of cardiac disease. I'd like to know that. That'd be great prevention for me. Secondary, establish screening clinics to measure cholesterol and hypertension. Right? Screening, who's going to be at risk? Tertiary, develop a community-based exercise program for a group of women who have cardiovascular disease. So the illness is already present. This group has cardiovascular disease. Now, how can we help them, treat them? Well, we could develop a community-based exercise program. Right? P, prevention, S, screening, T, treat. Okay? And you can go through women's health concerns. I don't need you to know this whole section, but know what the primary women's health concerns are. Eating disorders, reproductive health, gestational diabetes, menopause, breast cancer. Just have an idea of what they are. Same with men's health. What are the men's health concerns? Here's some prevention strategies for adults. So here's your primary intervention for health risks, reducing health risks across the lifespan for adults. Here's some ideas. And then we're still talking. So here's a couple of things about men: prostate cancer, testicular cancer, ED, And then it goes into health disparities among special groups. Have a look at why there are health disparities with adults of color, incarcerated, lesbian and gay, LGBT, adults with mental illness, frail. What are the concerns about the frail elderly? What are the issues? Again, they talk about elder abuse here. Okay. So the prevalence of frailty in the older population poses a major public health risk. I've already said this, because the majority of this group will reside in the community setting. They will be placing new demands on our healthcare system. They want to stay home. Family wants to care for them at home. And they're going to be taking up a lot of our community resources, right? To improve the health of our frail elderly, we have community-based nursing programs that we need to develop. There already are, but this population is growing. We need to develop ongoing community-based programs to address racial, ethnic, and socioeconomic disparities. And don't forget about the family caregiver. Somebody's taking care of those people at home. Yes, home health and all that might be coming in, but unless you're 24-hour care, you have, contracted out 24-hour care, family members are going to be taking care. Okay. And then know the difference of community settings. Let's say my mom's moving in with me. Oh my God forbid. But my mom's moving in with me and she's fine. She just is getting old. My dad died, which he hasn't, but my dad died and she's fine. She's with it. And she just, she's moved in after a couple of weeks. It's clear she's lonely. Okay. She's climbing the walls. What could she do? Maybe she'd go to a senior center. Okay. For socialization. But what if she starts falling? What if she starts cooking and she starts a fire? Okay. What do we do with these guys? We have adult day health, we have assisted living, we have long-term care facilities. Okay, so here's where that comes in, right? When will we use those? There's your practice application if you want to go through it. Okay, here's what we're going to do. We're going to stop real quick because I know time's running short. Here's what I'm going to do. I am going to go through really quickly. Go through chapter 31. There's a whole section on your study guide regards to school nursing. Okay. So, but before I do that, because I'm going to be over, I want to go back and do the attestation because that's what I promised. So everybody pull up their week 2 attestation. And then if you want to stay on for an extra 10 minutes, we'll do chapter 31, or at least I'll guide you through chapter 31. Oh, you guys have class after this. Is this the group that has class?
Yes,
We have
ma'am.
to eat at 2:00.
Okay. All right. Let's do the attestation. And you know what to do with chapter 31, right? Take a look at your PowerPoint, right? Go into the chapter outline. Go into your study guide. Let your study guide be a guide for what you need to know in chapter 31. Okay? All right, let's go to our attestation. Anybody have it pulled up? What are the questions?
Define primary, secondary, and tertiary prevention.
Okay, go ahead, define it. Primary prevention, secondary screening, tertiary testing. That's all you have to put in there. Oh, give an example of one. Primary, preventative education. Secondary, blood pressure screening at a health fair, right? Tertiary. Let's see. How about if we do a education session for diabetic patients on how to manage their blood sugar? Why is that tertiary? Why is that tertiary? They already
Because
have
they already-
diabetes, right? You know what I might do in the next couple of days? I might do another quick recording on chapter 31. Would that help you guys?
That would be amazing.
I'll do
Yes,
that for you.
please.
I'll do
Thank
that
you.
for you. I'll do that for you. Okay. So, but if you want to get ahead of me, I'm not going to get to do that for a couple of days, but if you want to get ahead of me, go to the study guide on page page 4 on the section of school nursing. It has 5 bullet points. That's a good place to start. Okay, but I'll do a recording for you guys for chapter 31 so that you get it. Okay,
Thank
so
you.
it's 12:57. So let's just stop. Let's just stop right there. And you guys go take a break, get a drink, whatever. And we'll see you. Reach out with any questions and we'll see you. Oh, next week is exam week. You'll get announcements from me. Okay. All right. Bye. Bye. Bye.
Thanks.
See you later, everybody. Have a good rest of the week.
Thank you.
You're welcome. I'll stay on for anybody that wants to stay on, but I think you all have class.
Yeah, I have class.
Okay.
Thank you.
Yep.
Professor.
Hi, Celine. Yep.
Hello.
Hi.
You had sent me an email.
Yep.
Earlier, not too long ago, around 12. Am I able to like say it out loud, like respond to email out loud, or would you like me to like respond back through the email?
Wait, what are we talking about here, Celine? Remind me.
Earlier you sent me an email because I didn't complete my professional development plan.
Oh,
and
yes. Where is it?
I didn't get to do it yet, and I actually have a reason, but I don't know if it.
Okay. Can you get it done today for me?
I didn't have time last week because Wednesday I had class. Thursday
That's
I
fine.
had to work.
Can you get it done for me today?
I had clinical.
I know you guys
yeah,
are
no
busy. I know this is a busy term, but I can't have you falling behind
Yeah,
early on.
problem.
So if you
Do I
can-
have to send in like any proof? Because I also got in a car accident this weekend. I have
are
like.
you okay?
I'm okay. My car is not, but I'm okay. So.
Oh, well, you know what? How about this? Why don't you take the next couple of days? How about if we agree to Wednesday? Can you get this
Yeah,
turned into by Wednesday?
That's no problem. Do
It
I have to
shouldn't.
like submit any proof or anything? Because I have like the report and everything if you need it.
But you don't. If I need it, I'll ask for it because I know you have it.
Okay.
But here's the way I wanted you to deal with it. Before, I didn't want to have to send you that email. I would have
Yeah.
preferred if you reached out to me and said, hey, listen, because I had 4 other students from all my classes reach out to me and say,
Okay.
I'm not going to be able to get it on time. This has happened. Can I turn it in Monday? Can I turn it in Monday or Tuesday? That's where I'm trying to get you guys at, is to be proactive.
Okay.
Okay. Oops, I need to end my